Late adulthood is a time of many changes, physically, psychologically, and socially. Persons in late adulthood must adjust to the effects of aging, including the loss of physical strength and health, and the death of loved ones, retirement, and preparation for their own death. Although the development tasks of this age appear to deal entirely with loss, the solutions to these problems often involve new relationships, friendships, and interests. There's a long list of disorders that are common among seniors. These typically are treatable, but few are presently curable. Researchers are looking for cures for many of these conditions. Most chronic conditions or illnesses of the elderly are not killers like cancer. However, if a senior develops any of them, the person can expect to live with it the rest of their lives. A comprehensive list is provided in the CCA manual, but a few of the common chronic conditions include Alzheimer's disease, arthritis, hardening of the arteries, cancer, cataracts, chronic obstructive pulmonary disorder or COPD, congestive heart failure, diabetes, heart disease, hypertension, osteoporosis, Parkinson's disease, and stroke. You should know that the most common chronic illnesses among seniors are arthritis and high blood pressure or hypertension. Can you distinguish between what is true and what is false about the aging process? We're all aging throughout our lives, since we're always getting older. But when we talk about the process of aging, we're usually referring to later adulthood, ages 65 and older, and the health changes that occur in those years. Because later adulthood covers an age range of as many as 25 to 35 years, people in this age category can have very different capabilities depending on their health. In other words, they're a very diverse group. Some 70-year-old people still enjoy active sports, while others are not active at all. Many 85-year-old people can still live alone, though others may live with family members or in long-term care facilities. Generalizations or stereotypes about older people are often false and create prejudices against the elderly that are as unfair as prejudices against racial, ethnic, or religious groups. While older adults do go through many physical, psychological, and social changes as they age, normal changes of aging do not mean that an older person must become dependent, ill, or inactive. Learning to separate normal changes of aging from signs of illness or disability will allow you to work most effectively with your elderly clients. For most older adults, the challenge of aging is the need to adjust to change. What are normal changes of aging? Aging is a continuous process from conception to death. Each person ages in a unique way, influenced by genetics and lifestyle. Although we cannot choose our genetic makeup, we can choose the lifestyle we lead. How long you live depends on how you've lived, your genetic predispositions, and avoiding diseases. Some of your older clients will need assistance in performing activities of daily living, or ADLs. Clients who are chronically ill and need a lot of help still benefit from living at home. As a CCA, you perform an important role in letting your older clients stay in familiar surroundings while getting the help they need. Changes in the skin, hair, and nails. The skin, hair, and nails change with age. Skin is thinner, drier, and more fragile. Much of the fatty layer beneath the skin is lost. The texture of the hair may change. Nails become harder and more brittle. Reduced circulation in the skin may cause dryness, itching, and irritation. Here are some care strategies. Reduce tub baths to twice a week. Dry skin can become very irritated and itchy if your elderly clients take too many tub baths. Older clients perspire less and do not need to bathe as often. Many elderly people generally need a complete bath only twice a week with sponge baths every day. Apply special moisturizing lotions to help relieve dry skin. Be gentle when assisting clients with personal care. Elderly clients' skin can be fragile and tear easily. Reduce shampooing to once or twice a week. Like the skin, hair becomes drier and needs to be shampooed less often. Brush dry hair to stimulate and distribute the natural oils. Changes in the muscles and bones. Older clients' muscles are not as strong as they once were, obviously, and atrophy faster the older they get. Bones may become more brittle and porous. Joints may be stiff and become painful. Illness, poor balance, or difficulty walking may discourage some clients from moving about, changing position, or performing activities. Here are some care strategies. To prevent further loss of physical and mental capacities, encourage clients to perform ADLs and range of motion exercises that they're capable of within the guidelines of the care plan. Encourage clients to eat in the kitchen and walk to the bathroom, for example, until these activities are no longer possible. Just getting them up and moving them around can make a big difference in their overall health. Slowing down as you age is really a myth. Truth is, you need to move more as you age, not less. The antidote to muscle and bone deterioration is exercise and a proper diet. Encourage clients to make decisions and dress themselves with assistance if necessary, no matter how long it takes. To prevent or slow osteoporosis, the condition that's responsible for fragile bones, again, clients should be encouraged to walk and do other light exercise. Weight-bearing exercise can strengthen the bones as well as muscles. Changes in the nervous system. The mental function. As we age, we lose some of our ability to process and retrieve information. How much ability we lose depends on the individual. Aging can also affect concentration and memory. Elderly clients may experience memory loss of recent events. This short-term memory loss may cause anxiety in older clients. Long-term memory, or memory from past events, usually remain sharp, and many elderly people enjoy reminiscing or talking about the past. As we age, maturity and long experience in life give us a different perspective on the past. By reminiscing, we can review our lives and resolve long-standing problems. In my opinion, you can never, ever have a boring conversation with an elderly person. The secret is to ask them a lot of questions about things that are of interest to them and then listen to their stories. More care strategies. You may be able to help your client with memory loss by suggesting they make lists or write notes about things they want to remember. Placing a calendar or clock nearby may help the client remain oriented. Take an interest in your client's past experiences when they reminisce by asking to see photos or hear stories. Help clients find new hobbies or activities. Older people are still able to learn and enjoy new activities, although sometimes they don't learn as quickly as younger adults. Changes in vision, hearing, taste, and smell. The failing vision of many elderly clients may make reading or other activities difficult or impossible. Failing hearing may make it frustrating for older adults to try to communicate. The loss of vision and hearing are often mistaken or misunderstood as dementia. The truth is, the person just cannot see well, especially perhaps at night, nor can they hear you. Weakened sense of smell, taste, and touch may present dangers for older adults as well. More care strategies. Offer reading options. Many books and sub-magazines are available printed large type. Talking books or books on tape are available at libraries and bookstores. Keep clients' eyeglasses clean. Bright colors and good light will also help clients with poor eyesight. Sometimes the eyes of the elderly do not adapt quickly to glare or changes from light to dark. Encourage clients to wear sunglasses outdoors. Be sure the lights are on before your client enters a room. If your client's having trouble hearing, try speaking in a low-pitched voice. For some people, low-pitched sounds are easier to hear. You may also need to repeat words to help the client understand them. Some clients need hearing aids and should be encouraged to use them. Excess earwax can make hearing difficult. If you suspect excess earwax, tell your supervisor. If a client has difficulty hearing, face him or her and speak slowly, simply, and clearly. Be careful not to overdo this. Don't assume that your elderly clients are all hard of hearing. Speaking loudly or oversimplifying your speech when it's not necessary can make clients feel like kids. Because we lose taste buds as we age, older people often cannot taste as well. Decreased sense of smell may contribute to the altered sense of taste. Encourage your clients to use artificial sweeteners. Make sure the food in the house is fresh because older adults may not be able to smell or taste the food that's spoiled. Older clients should always have smoke and carbon monoxide detectors in their homes, particularly since they may not smell leaking gas or smoke. The sense of touch is also affected by aging. Be careful with hot drinks and hot bath water. Clients sometimes cannot tell if something is too hot for them. The elderly client who's confined to a bed may not feel uncomfortable, but because of decreased circulation and dry skin, he or she is at risk for developing pressure sores. The sense of pain may also be diminished in the elderly. As always, be alert to changes in your client's health. Watch for signs of disorientation or confusion about time and place. This may occur in new surroundings or as a result of infection or medication. Disorientation is not a normal part of aging. Disorientation caused by medication is called drug intoxication. Many elderly people take one or more kinds of medication, and taking the wrong amount or combination of medications can cause disorientation. If you suspect the client's taking medication incorrectly, notify your supervisor. Encourage your clients to get an annual eye and hearing exam. As with all changes in your client's health, always report any observations you make about decreased senses. Disorientation may be a sign and symptom of an illness. Changes in the circulatory system. As we age, our hearts pump less efficiently. Increased activity places greater demand on the heart, which it may not be able to meet. Older people may need more rest to reduce demand on their heart. They may not be able to walk long distances, climb stairs, or exert themselves anymore. Here are a few care strategies. Moderate exercise is necessary and helpful. Walking, stretching, even lifting light weights can help older people maintain strength and mobility and increase bone density. Active or passive exercises are important for clients who cannot get out of bed. Your client care plans will specify what kinds of exercise or activity they should be doing. Abilities can vary a great deal from client to client. Clients with heart conditions, particularly heart failure, must avoid vigorous activity or exercise, including carrying heavy objects. Some clients may experience dizziness when they stand up too quickly. Encourage clients to rise slowly and to stand for a few moments, supporting themselves by holding on to a chair or other piece of furniture. Changes in circulation and sensitivity to hot and cold. Less efficient circulation of blood in older people causes older adults to be more sensitive to the cold. Here's a few care strategies. Houses may need to be kept at a higher temperature than normally preferred, and older clients may need to wear layers of clothing to keep them warm. Some elderly clients who are concerned about the cost of heating may actually lower the thermostat to a dangerous level. Poor circulation in the extremities causes the feet to feel cold. Be sure your client wears slippers or shoes and socks. Don't use hot water bottles or heating pads. Poor circulation causes dry skin that's fragile and can burn very easily. In addition, because of the dulled sense of pain mentioned previously, an older person may not realize he or she is being burned until it's too late. Changes in the respiratory system. Shortness of breath. As the body ages, the lungs have less capacity. Shortness of breath is a common problem for older adults. Older clients may also have a harder time coughing up mucus. A few more care strategies. You may need to provide frequent rest periods for your clients when assisting them with activities of daily living. Follow the care plan carefully for exercise and activity instructions. As before in the guidelines associated with circulatory system, moderate exercise is helpful, but overdoing it can be very dangerous for an older adult. If you have a question about the activity level specified in the care plan, talk to your supervisor. Changes in the urinary system. Urine elimination. The bladder is not able to hold the same amount of urine as it did when clients were younger. Older clients may need to urinate more frequently. Many elderly persons awaken several times during the night to urinate. A few care notes. Clients should always drink plenty of fluids during the day. Dehydration is a leading cause of fatigue. However, Some clients should reduce the fluids in the evening to avoid frequent trips to the bathroom at night. Incontinence is the inability to control the bladder. Incontinence is not a normal part of aging. For clients who are incontinent, the care plan may specify bladder retraining, or the client may wear incontinence pads or briefs. A few care considerations. Always report incontinence. It may be a sign of illness. Cleanliness and good skin care are important for clients who are incontinent. Changes in the digestive system. Poor nutrition. Older people who cannot get around easily or who live alone may skip meals or eat foods that are not nutritious. A dulled sense of taste, often made worse by side effects of medications, may result in poor appetite. Here's a few care strategies. You may be assigned to shop for and prepare meals to improve nutrition. Older people may have trouble chewing because of loose dentures, dental problems, or gum disease, and may require soft foods. Decreased saliva production not only affects the ability to chew, but also places older clients at risk of choking. Provide plenty of fluids with meals. Changes in digestion and bowel elimination. Digestion takes longer and is less efficient in older adults. Many older adults have trouble with indigestion or an upset stomach. Body waste moves more slowly through the intestines, and constipation, the inability to have a bowel movement, may occur. Here's a few care notes. Some clients need to eat several small meals a day or have the large meal in the middle of the day. Clients should be encouraged to drink plenty of fluids to keep bowel movements moist. Clients should eat a diet that contains fiber. Dehydration is a condition that results from inadequate fluid in the body. It's not a normal sign of aging. However, many older people do not feel thirsty and may not be aware that they're dehydrated. Dehydration can cause fatigue, constipation, weight loss, dry skin, infection, dizziness and weakness, and other illnesses that require medical attention. Some good care notes. Encourage clients to drink water and other fluids each day. Several medical conditions and medications can affect a client's hydration status, so always check with your supervisor before increasing a client's fluid intake. You may be assigned to measure fluid intake and output. Measure and document carefully to ensure that the client's fluid balance is healthy. Changes in the endocrine system. Pancreas function lessens, which may lead to diabetes for some clients. Here's a care note. Older clients may need to take insulin or eat certain foods to regulate blood sugar. The client's doctor or nurse will teach the client what to do. Any special instructions on care you will give will be included in the care plan. Changes in the reproductive system. Changes in genitals. Genital areas may become dry and uncomfortable. Size and shape of the genitals change with age. A few care strategies. Avoiding too many hot baths can help prevent discomfort in the genital area. Though the reproductive organs change, sexual needs and desires do not necessarily change. Allow your clients as much privacy as you can while still providing good care. Don't make any assumptions or generalizations about the sexual feelings of older adults. Do report any behavior that makes you uncomfortable or that seems inappropriate. Inappropriate behavior is not a normal sign of aging and could be a sign of illness. Changes in the immune system. As we age, our immune system gradually weakens. It may also take longer to recover from illness. Bone marrow activity, which produces white blood cells that fight infections, decreases as we age. Changes in the respiratory system's protective surface may result in increased respiratory infections. Many elderly people develop anemia, especially iron deficiency anemia, due to poor nutrition and less efficient use of nutrients by the body. While anemia is common, it's not a normal sign of aging. Report any signs and symptoms of anemia, including weakness, fainting, lightheadedness, headache. Here's a few care strategies. Vaccines against common infections such as the flu are very important for older adults. Helping the client maintain good nutrition can help him stay healthy. Changes in the lymphatic system. The number and size of lymph nodes is reduced. Along with the changes in the immune system, these changes result in the body's decreased ability to create a fever to fight infection. Here's a care note. An older adult fighting an infection may not experience a high fever. Even a slight temperature increase may be an indication of infection. Psychological changes. Some forgetfulness is a normal part of aging, but constant memory lapses or forgetting basic information such as family members' names are not normal parts of aging. Any of the following signs should be reported to your supervisor immediately, as they may indicate illness. Disorientation or change in the ability to remember who they are, what month or season of the year it is, or other basic information or facts. Difficulty concentrating, depression, dementia, or loss of mental abilities that interferes with ADLs, confusion, suicidal thoughts, insomnia or the inability to sleep. Depression is a very common thing among the elderly, especially men, but it's not a normal sign of aging. Elderly people may not admit feelings of depression to themselves or to others. According to the National Center for Health Statistics, the elderly are at a higher risk for suicide than any other age group. Report any signs of depression in your clients to your supervisor. In many cases, depression may be successfully treated. Observing and reporting signs and symptoms is the best way to help a client who may be suffering from depression. Common signs and symptoms of depression include anorexia, loss of appetite, insomnia, difficulty sleeping, acting moody or withdrawn, changes in appearance, speech, movement, and behavior. Sleep disorders and emotional changes such as hopelessness, anxiety, apathy or lack of interest, agitation, restlessness, and demanding or violent behavior are particularly important to report. Lifestyle changes. Aging brings many social, physical, and mental changes. Friends, colleagues, and relatives die. Physical strength and stamina diminish, and fears of illness, injury, and death may increase. Retirement causes changes in what and how much people do each day. Living arrangements may also change. These changes require adjustment, which can become more difficult as people age. A few care strategies. You can help your clients adjust to change by listening to them and caring about their feelings. We have 2 ears and just 1 mouth, so let's listen twice as much as we talk. Ensuring that clients are safe is another way you can help adapt to their changing lifestyles. The psychological and social needs of older adults are the same for younger people. The need for love and affection and touching and acceptance by others and the interaction with other people don't go away with age. Can you list some attitudes and living habits that promote good mental and physical health for older adults? Staying active, maintaining self-esteem, and living independently can promote physical and mental health for older adults. You can encourage your clients in these attitudes and habits in the following ways. Encourage your clients to pursue activities they enjoy and can succeed in. Help clients develop a routine for the day, structuring the day around meals, activities, rest, and self-care. All that will help fight depression and provide a sense of purpose. Encourage self-care. Your job is to assist with or perform activities the client cannot do alone. Help your clients be well-groomed. Appearance affects the way we feel about ourselves. Clients who are well-groomed will feel better about themselves. Address your clients respectfully. Use your client's last name with whatever title they prefer. Respect the needs for privacy and for social interaction. When visitors come by our call, let your client visit undisturbed and don't try to participate in the conversation. Treat visitors respectfully and make them feel welcome too. Do you know how to recognize and report elder abuse and neglect? In the past 10 years, the health community has become aware of the problem of elder abuse and neglect in America. In 1991, it was estimated that between 1.5 million and 2 million cases of elder abuse occur in the United States each year. As the elderly population grows, this problem may become worse. Elderly people may be abused intentionally or unintentionally through ignorance, inexperience, or inability to care for them. People who abuse elders may mistreat them physically, psychologically, verbally, financially, and/or materially. They may deprive them of their rights, or they may neglect them by failing to provide food, clothing, shelter, or medical care. Some older adults may also become self-abusive or neglect their own needs. Some signs of elder abuse are old and new bruises, contusions and welts, scars, fractures or dislocations, burns of unusual shape in unusual locations, scalp tenderness and patches of missing hair, swelling in the face, broken teeth, nasal discharge, bruises, bleeding or discharge from the vaginal area, withdrawal or apathy, agitation, low self-esteem, client or family reports of questionable care, fear, vigilance, apprehension, mood changes, confusion, and disorientation. Weight loss is another. Pill counts not changing. Living conditions that are unsafe, unclean, or inadequate. And private conversations are not allowed, or family member, caregiver is present during all conversations. Working with elderly clients, you'll be in an excellent position to observe and report abuse or neglect. In many states, reporting abuse is also a legal responsibility. Give your supervisor as much information as possible so the supervisor can contact the appropriate members of the healthcare team. You may be requested to fill out a report form. Please take this responsibility very seriously and help end this disturbing trend. Well, that concludes Chapter 8, and I know we covered a lot of material. You owe yourself a pat on the back for making the commitment and effort to improve your professional skills. I look forward to being with you later in the section.